Hello everyone, welcome to your lecture on integumentary and wounds. These are the objectives we will be covering in this lecture. This section here explains the anatomy of the skin, which I will let you review, and we will move on to the topics that we need to cover in block 1. Now, why is the skin important? Remember, we talked about defense mechanisms, and your integumentary system was one of them. It offers protection. It also regulates body temperature. It actually affects our psychosocial status. And then it helps with sensation, helps with vitamin D production, it helps with immunity, absorption, and elimination, for example, through sweating. Right? What are the different factors that affect the integrity of our skin? We have our state of health. People, chronic disease can affect it, and age can affect it. Your nutrition, adequately nourished and hydrated body cells are more resistant to injury. Circulation, your blood circulation is necessary to maintain life, right? Very thin and obese people are more susceptible to skin injury. Dehydration and illness can predispose your skin to breakdown. Jaundice causes yellowish, itchy skin. The jaundice happens with people who, for example, have liver disease. Diseases of the skin, such as eczema and psoriasis, can also cause lesions that require special care. So these are the different factors that affect our skin. What are some developmental considerations in older adults? They have reduced skin elasticity, decreased collagen, thinning of underlying muscle and tissue, and the attachment between the epidermis and dermis becomes flattened, so they're easily, exposed to, like with skin tears. It's very common in older adults. Then you have a decreased barrier function. You have healing requires more time, increased risk of continence and subsequent skin injury related to comorbidities, for example, diabetes, hypertension, vascular diseases. When we have to be careful because when we're removing adhesive dressings, and because of the same reason, because their skin is very sensitive. They have decreased subcutaneous tissue. This reduces the padding protection over bony prominences, and this can cause shear injuries, for example, pressure injuries. What are the different types of wound? Before you jump into the different types, let's talk about what a wound is. A wound is a break or disruption in the normal integrity of the skin and tissues. There are different types. You have intentional wounds, means a surgical wound where, you had a surgery and so now you have an incision. Or you have unintentional, for example, a traumatic wound, say you got, hit by a hammer on your hand and it broke your skin. So that's a traumatic wound. Then you have neuropathic and vascular wounds. These are caused by chronic conditions such as diabetes or vascular issues, circulation issues. Then we have pressure-related injuries. Then open and closed wounds. A wound can be, your skin integrity can be intact, but you still have a wound. It just shows a discolored area. Or you can have, an open wound that obviously is open and you see it. Then you have acute or chronic wound. Acute is, short-lived. You treat it and it's gone. Chronic just lasts longer and longer. And then we have partial thickness and full thickness wounds, and we'll talk a little bit about these in the next few slides. Now, the different parts of the wound. This is the edge of the wound. This right around the wound is the edge of the wound. Then you have the base of the wound. That's the inside base of the wound. Then we have the depth of the wound, how deep the wound is from the skin surface. The peri-wound is the area around the wound, up to about 4 to 5 centimeters. Then some wounds can have tunneling, where you have these little tiny tunnels in the middle of the wound, and that happens from just shearing or, friction. Then we have undermining, that also is caused by, shearing. And if you notice, it's detached from the rest of the wound. So these are the different parts of the wound. Open and closed wounds. Open wounds are intentional or unintentional, for example, surgical wounds or traumatic wounds. The features include that the skin is broken, that's open, And then the risk, what are the risks? We talked about this even when we talked about in your infection PowerPoint, sorry. You know, you have risk of tissue damage, bleeding, delayed healing, and infection. Now the skin's open, now there is that risk of pathogens entering the wound. Examples include incisions, abrasions, pressure injuries. What are closed wounds? Closed wounds, the causes include blow, like a blow wound, force wound, trauma wound. When you get hit by something really hard, your skin is intact, but there's a wound underneath your skin. So risks include soft tissue damage. This over here, the bruising on the leg, as you can see, on this area, you can see, sorry, the hand, is actually tissue damage. It shows tissue damage. You see the discoloration over there, right? It's an internal injury and there is bleeding underneath the skin. Examples include ecchymosis and hematomas. Then we have acute and chronic wounds. Acute wounds are traumatic, or it can be traumatic or surgical, intentional or unintentional. They occur suddenly. The wound edges are approximated. That means put together, like through sutures or staples, right? And then they progress normally through the healing process. They're, and they go through it fast. They have a low risk of infection because they're closed up. They're approximated, right? Put together and sewed up together or stapled together. So they actually have less chance of, getting an infection. There is an infection risk, but it's not as high as, other wounds. And then we have chronic wounds. These are delayed healing wounds. They do not heal in the normal process. They don't go through the healing process in the same way as a acute wound does. The skin surface is broken. You have the risk of infection, tissue damage, bleeding, delayed healing. For example, diabetic ulcers are an example of a chronic wound. As you can see, this patient has a diabetic ulcer on their plantar area, and that is considered a chronic wound. Then we have partial and full thickness wounds. Partial thickness wounds are wounds where there's damage to the epidermis. No subcutaneous tissue is exposed. As you can see in this picture here, you have damage to the epidermis, but the subcutaneous tissue has not been exposed yet. So they're usually less than 0.2 centimeters deep. Examples of these include skin tears, first-degree burns, or stage 2 pressure injuries. Then we have full thickness wounds. This is where the damage extends to the subcutaneous tissue and below. As you can see, it's much deeper than this one here. It extends all the way down to the subcutaneous tissue, and it can also go all the way down to the bone. Those are called full thickness wounds. Examples include venous ulcers, full thickness burns. Then we have stage 4 pressure injuries are also, a full thickness wound. These are different types of wound, and please, review this slide. You have incisions, contusions, abrasions, lacerations, chemical burns, thermal injuries, radiation injuries, venous arterial ulcers, pressure and diabetic ulcers. So please kind of read over the description of each of these. Wound healing. Let's talk a little bit about wound healing. Wound healing has 4 stages. The first stage is the hemostasis stage. This is where coagulation happens, right? Blood vessels will, say a person gets hit by a nail. Now you have that opening for example, they got hit by a nail on the finger. Now you have that opening on that finger. And so the blood vessels constrict, and then the platelets gather, clotting factors, occur to stop bleeding. For example, this feature helps protect us, right? Because when blood clotting happens, the bleeding stops. If we did not have the feature of coagulation or clotting, we can just bleed out until we die, right? So this helps to actually, protects us from bleeding out. Then the fibrin matrix formation happens. You have this matrix of fibrin helping to start healing the wound. Then this happens immediately. The second stage is the inflammatory stage. This can take about 1 to 3 days. This is when the white blood cells arrive. Leukocytes ingest the bacteria and the cellular debris, right? And the macrophages, they release growth factors because what is your body trying to do? It's trying to heal the area of damage. And so epithelialization, where epithelial cells form a new surface layer, Then we have, then we have exited, liquid drainage. It's composed of plasma and blood, and you start seeing, some drainage there, liquid drainage. Then you have acute inflammation. This acute inflammation actually promotes healing. Remember, we said inflammation was a defense mechanism. It also helps our body to, protect itself from damage, and it helps us to close the wound so we don't get exposed to bacteria. The next stage is the proliferative stage. This can last from 14 to 21 days, also known as the repair phase. This is where actual healing occurs. The fibroblasts secrete collagen, then formation of blood vessels, endothelial and capillary. It helps with all of that. And then you have, oxygenation and nutrition at the site through your circulation. Then granulation occurs. This is when new tissue is formed, highly vascular red and, tissue cells, and you'll see bleeding. Granulation tissue looks beefy red. If you Google it, you'll see pictures of it, and it's very beefy, shiny red, very vascular type of tissue. Then we have the maturation phase. This can take months to years, right? Depending on a lot of factors, the person's age, the person's health condition, their stress level, their immunity, all of those things we talked about that affect, factors that affect wound healing. This is the final stage of the healing process. It starts about 3 weeks after the injury. The collagen strengthens the wound. Then you have scar formation. This is it. What is a scar? A scar is a vascular tissue that does not sweat, grow hair or tan in sunlight. The tissues, but always remember, like once a patient has a wound on a certain area of their body, their tissue strength remains at about 70 to 80% of their original, skin. Wound repair. How does the wound repair? Now, we talked a little bit about the healing stages in the previous slide. Now, what happens? With partial thickness wounds that are very shallow, remember we said they're usually less than 0.2 centimeters, and the subcutaneous fat is not exposed. So how do these heal? You have the inflammatory response, the redness, swelling, moderate serous exudate, epithelial cells start to regenerate. Then we have epithelial proliferation and migration. This is when the edges start to resurface. The wound can resurface in 4 to 7 days. Moist wounds resurface faster. The goal is to keep them moist and keep them free from infection. Then we have the re-establishment of the epidermal layer. Epithelialization. That's when your epithelial cells cover the wound and, it appears as dry pink tissue. But full thickness wounds, because of their depth and their complexity, take longer to heal. And it's extremely important in full thickness wounds to protect them from infection, protect them from delayed healing, and taking good care of them and, following wound care orders, because otherwise they can, constantly get infected. So there are 4 phases. Of course, we have the hemostasis phase. These are the 4 phases we discussed in the previous slide, where we talked about the 4 stages of wound healing, right? So that applies to full thickness wounds. Partial thickness wounds, don't have the full 4 stages. They only have the inflammatory response, epithelial proliferation, migration, and reestablishment of the epidermal layer. But full thickness wounds go through those 4 phases of hemostasis, inflammatory phase, the proliferation phase, and the maturation phase we discussed in the previous slide. What are the different types of wound healing? We have primary wound healing. This is when the wound is approximated. This is usually for surgical wounds. They're intentional, there's minimal tissue damage, there's fast healing, you'll have minimal scarring, and it's a low risk of infection because the wound has been approximated and closed. Example is a surgical incision. Now, if it's infected, then it will heal by a secondary intention, which is, the next one. That's why it's so important when a person has a surgical wound to make sure we protect it from infection, so it does not end up in a secondary healing stage. Secondary wound healing is for large open wounds. As you can see, they're wide open. They haven't been approximated and put together through sutures or staples. There's a lot more tissue loss. There's a high risk of infection because it's wide open, and they're longer healing time because it's a bigger wound. You'll see a lot more scar tissue and can easily get contaminated. These include burn wounds, open wounds from major trauma. Then we have tertiary wound healing. This is delayed primary closure infected wounds. For what happens is when a wound gets infected, they're left open to resolve the infection, edema, or any fluid to drain. And then after that is the tissue is resolved, they are closed by primary intention. So if the wound gets infected, they leave it open, try to get rid of the infection, and then once the infection is gone, then they will go ahead and approximate it like they approximate a primary wound. When does abnormal wound healing happen? We talked about the different stages, right? For like partial thickness, there are 3 stages. For full thickness, there are four stages. A healthy, normal wound will go through those stages in a normal fashion in a normal time period. But abnormal wound healing, for example, in primary intention wounds, would happen when the incision is poorly approximated. Remember we talked about how it's approximated with staples or sutures. For example, if some of the staples came off or some of the sutures got loose, and then that would cause delayed wound healing, right? The drainage is present more than 3 days, then you know there's something wrong. Inflammation is increased 3 to 5 days after the injury. There's no healing ridge by day 9. These are signs that your primary intention wound is not healing normally. Then how do we know whether secondary intention wound is not healing properly? You'll notice paleness, fragile granulation tissue, or you'll see hypergranulation. Hypergranulation means when there's too much granulation tissue, where it goes above the level of the skin. Or if you see purulent drainage coming out of the wound, purulent exudate. Or if you see necrotic dead tissue or slough on the wound bed. If there's odor present, wounds should never have an odor. When you see there's an odor present, that means there's it's abnormal and it's, maybe infected. Then you have fistula or tunneling or undermining. All of these are signs that your secondary intention wound is not healing normally. Now, what affects wound healing? You have local factors, you have systemic factors, and then you have nutrition. Local factors are pressure. If a patient has pressure by the wound, obviously they're going to develop a pressure injury. Desiccation, for example, dehydration. Maceration, sometimes the wound can get overhydrated and it leaves these white patches, which are maceration. You can have trauma. You have a wound and then all of a sudden they get trauma on the same site. That can affect wound healing. Edema, swelling, right? Buildup of fluid by the wound. Infection in the wound. Excessive drainage. Necrosis, death of tissue, causes eschar, like dry, black, leathery tissue. And if you have like a very thick biofilm, like these microbes, a film of like layer of microbes on top of the wound, all of these can affect wound healing. And these are local effects. Then we have systemic effects. Systemic effects include age, improper, inadequate circulation of your blood, inadequate oxygenation, not adequate nutrition, wound etiology, like what's causing the wound. For example, if it's a wound because of diabetes and the patient is not monitoring or managing their blood sugars, then that can affect wound healing. Medication can affect wound healing. Medications that suppress your immunity actually will cause the wound to have delayed healing. Then we have other therapies that can also, affect wound healing. Immunosuppression, non-adherence to treatment. That's a huge one. When patients are not adherent to their wound care, it causes their wounds to have delayed healing. What is the nutrition? What are the nutritional aspects that affect wound healing? We have protein malnutrition, not getting enough protein or inadequate, protein. Calorie deficit. Uncontrolled glucose monitoring. Patients who are diabetic who do not monitor their blood glucose or manage them, that can cause nutritional deficits. Dehydration, not getting enough, drinking enough water and fluids. Vitamin deficiencies. So a patient who has a wound, in order for the wound to heal normally, they need protein, glucose, fats, fluids, iodine, vitamins, and those vitamins are A, D, E, K, C, B, minerals, and copper and iron. And zinc is another one that they need to promote wound healing. Now, if the patient has a wound, sometimes we have complication. We talked about a little bit about infection, but infection is a huge complication from wounds, because remember, our integumentary, our skin is our defense mechanism. When it opens up and you have a wound, now you have that very high risk of getting an infection, right? What are the risks? Trauma, surgery, contamination, hospital-acquired infections, right? Then we have the symptoms. When a patient gets an infection in their wound, symptoms appear 2 to 7 days after the initial wound develops, right? Symptoms include purulent drainage, increased drainage, pain, redness, swelling, increased body temperature. They'll have an increased white blood cell count, and they'll notice delayed healing. So all of these are signs of, an infection to the wound. Other complications include hemorrhage. For example, a patient has a primary intention wound, and there's sutures and staples, or a suture, and a suture slips and opens up, and you have a dislodged blood clot that can also cause, bleeding to happen. Hemorrhage means bleeding. Erosion of the blood vessel by a foreign object. For example, they get hit by a foreign object and, the blood vessel, erodes. So this is when the person starts hemorrhaging. What can you do as a nurse? You check the site frequently. Every 48 hours, you check that site. Surgical sites every 8 hours. For 48 hours, if excessive bleeding occurs, put pressure dressing or packing on the on the wound and hold it there. And they will need, after that, they're going to need, surgical intervention to close that wound up. So a hematoma is basically a localized mass of clotted blood caused by internal hemorrhage. Sometimes wounds can develop fistulas. You can have fistulas. Fistulas are basically sinus tracts, right? They're narrow passageways that extend from the wound underneath the skin in any direction through the soft tissue. And it results in this dead space inside the body, like this opening, this tunnel, the sinus tract. And abscess is a collection of fluid, which is infected, that gets accumulated, and if it's not drained, it can cause pressure in the surrounding area of the tissue, and it leads to a fistula. And fistula, again, is an abnormal passage from an internal organ or vessel to the outside of the body. What causes these fistulas and these sinus tracts and abscesses is, it's just not taking proper care of the wound, right? So what are the risks? We have delayed healing, additional infection, fluid and electrolyte imbalances, and skin breakdown. Other wound complications include dehiscence and evisceration. Dehiscence is when a wound is partially separated or fully separated. The wound layers have separated, right? Because of stress on that wound. For example, if you notice here, the sutures have opened up, it's partially opened up, and you see the exposed layers. This is called dehiscence. Evisceration is when it's a very serious complication. This is when you have that opening, for example, like over here, and then your internal organs protrude out of that incision. And usually happens in abdominal incisions. You see patients who have these big abdominal incisions, and then they cough really hard or they sneeze really hard, and all of a sudden it puts pressure in the surrounding tissue of that wound and causes the internal organs to protrude out, right? Now, when something like that happens, we don't just push those organs back in. No, we don't do that. What we do is we take sterile cloths or sterile dressings, whatever we have, something wet with sterile water, a towel with sterile water, and we put over there, and they have to be rushed for surgical intervention. So what are the risk factors? How do you develop this? It can happen because of obesity, tobacco smoking, malnutrition, anticoagulant use, infected wounds. Infections can cause these things to happen too. Excessive coughing, vomiting, or straining in the area of that wound. Now let's talk a little bit about skin disorders. There are different types of skin disorders. You have primary and you have secondary. Primary originate from previously healthy skin, and then a person develops a lesion. Secondary lesions develop when from the primary lesion due to traumatic manipulation, scratching, rubbing, treatments or other things. So these are your secondary lesions. Please just look at those and review them. Now you have, the different types. You have cysts, you have macules, you have papules, you have wheals, vesicles, ulcers, pustules, and crusts. These are the different types of skin disorders. Then we have fungal infections. We call them tinea, ringworm. They're yeast-like organisms. They colonize the skin, GI tract, GU tract, and vagina. And it's caused by malnutrition, poor hygiene, warm, so in tropical warm climates, physical contact with somebody else who has it, immunosuppression, medications, contact sports. Athletes get it in, locker rooms. They'll get like athlete's foot. And that's basically fungal infection between their toes, right? They're called jock itch. That's when it happens in the groin area. Then you have scalp ringworm, body ringworm, and then nail infections. All of these are fungal infections. What are the signs and symptoms? For athlete foot, you'll notice a whitening between the toes. For jock itch, you'll see in the groin area red ring patches, itching, and pain are your signs and symptoms. The scalp ringworm, again, is itchy, scaly rash on the scalp, and you'll see hair loss in the area of that where the ringworm is. Then you have nail infection. You see thickening of the nails, yellowish nails. Body ringworm, you'll see circular lesions, lighter in the middle, and raised edges. Those are ringworms, body ringworms. How do we treat these? We treat them with oral or topical antifungals, which are prescribed by the doctor, and special shampoos, and even steroids. To help with the overreaction of the immune system to these fungal infections. Then we have candidiasis, yeast infections, right? Yeast-like organisms, they colonize your skin, your GI tract, GU tract, and the vagina, right? Physical features include you have pustules, papules, plaques, crusts, white exudate coming from the wound, drainage. You have satellite lesions, basically lesions around the actual wound. Pruritus is itching. You have a lot of itching, burning at the site. It's found in skin folds. People who are, have a lot of, who are obese, they have between their skin folds. Then you have yeast infection in the vaginal area. Then you have it in the mouth. You call it thrush. And, it happens with improper oral care or, people develop an infection. What are the signs and symptoms? The major signs and symptoms include itching, burning, satellite lesions, and budding spores. These are treated by reducing the cause. What causes the yeast? We fix that first. Then their body powders that help prevent the moisture. Then you have topical antifungals that, doctors will prescribe. Then we have bed bugs. Yes, these are bed bugs. And basically, they're small, flat, parasitic insects. They feed on the blood from people and animals. They're reddish and brown in color. They're wingless. They're about 1 to 7 millimeters big. They live they can live several months without eating. So they can just live there. And where do they live? They're found all over the place. They're usually found about 8 feet within sleeping areas, and they can travel about 100 feet at night. They hide in the day in mattresses, bed frames, headboards, tables, wallpapers, and cluttered objects. The health risks include they can cause disease. They cause itchy skin, loss of sleep, serious allergic reactions. What are the signs and symptoms? You'll notice bite marks, and they can take 14 days to show. So once you get bit by a bed bug, it can take up to 14 days for that bite mark to show. They also, the bed bugs have an exoskeleton. After, molting, you'll see these little skeletons, in your mattresses and the sheets. Rusty colored spots. They're blood-filled fecal matter from the bed bug. Then we have it has a sweet, musty odor. You'll smell that, where in the area where the bed bugs are. How are these treated? Antiseptic creams, antihistamines, to help with the severe allergic reactions, insecticide sprays, and avoid, not scratching. And they're actually, you could call professionals in, people call professionals in who come in and, clean up the area. There are specific things that they do. Then we have scabies. It's basically the human itch mite, right? The transmission occurs from prolonged skin contact with somebody else who has scabies, contact with contaminated objects. Crested scabies is more contagious and usually contains thousands and thousands of mites, right? And the infected person can harbor 20,000 mites in a very small area. And if you notice here, this is the classic scabies and this is the crested scabies right here. So what are the signs and symptoms? They'll have a lot of itching, especially at night. They'll have these papulovesicular erythematous rash, like this one right here. Then they have burrows from the mite tunneling, tiny raised grayish white between fingers and folds, as you can see here, right? You see these burrows over here. And the wrists, elbows, knees, breasts, shoulders. In infants, you'll see it on the head, face, and the neck, and palms. Symptoms occur 2 to 6 weeks after infestation. When crusted, the crusting is visible. You see the scales and, in the crusting, and there are large numbers of mites. And there's less itching, but it's extremely contagious when it's crusted. How is it treated? They treat it with a promethazine cream 5%. It's applied all over the body for about 8 to 12 hours, and then it's washed off, and then they do it a second time a week later. Everybody who's in the household who had contact also gets treated. And sometimes they get an oral medication, the oral ivermectin. It's single dose of 200, units per gram, and repeated 1 to 2 weeks. Should not be used for children under 15 kgs, but the medication obviously is prescribed by the doctor. Then last but not least, we have ticks. They're not very common, in Arizona, but these are small blood-feeding parasites. They're associated with rodents. They burrow their mouths into the skin for a blood meal, and their bodies become large from the amount of blood ingested. They feed for several minutes to days. They're found usually, in lying around vegetation, grassy, bushy, or wooded areas. Mostly you'll see them in wooded areas. The health risks include tick-borne disease, Lyme disease, Rocky Mountain spotted fever, relapsing fever, tick paralysis, and tularemia. They're treated by removing the tick first, then it's sent for testing, and then, symptoms are treated, and possibly they'll get antibiotics. How do we remove the tick? You use a clean, fine tipped tweezer, grab as close to the skin as possible. You pull forward and steady with steady pressure. Don't twist it, because if you twist it, then the mouth part may fall off. You put that in a bag, in alcohol sealed bag, wrap in tape, and flush it down the toilet. That's how the ticks are removed. What signs and symptoms do we see? We see, depending on, what it causes. For example, if it causes tick-borne diseases such as Lyme disease, Rocky Mountain fever, and all of those, depends on the symptoms you'll see. You'll have fever and chills, aches and pains, rash, tick paralysis, alpha-gal syndrome, low blood pressure, shortness of breath, dizziness, swelling of the lips and the throat. These are all symptoms of ticks, the disease caused by ticks. Let's talk a little bit about patient and caregiver education. How do we educate our patients and their caregivers? Because remember, the caregivers are the ones who are going to help with the wound care and take care of the patient. So it's important to include the caregivers in the education. We want to always tell them to follow physician's orders with wound care and contact the healthcare worker if they have any questions. Encourage hand hygiene. Wash hands before and after changing a dressing. A lot of patients and caregivers sometimes, they're families, right? And they sometimes might not see the significance of wearing gloves or washing their hands or doing hand hygiene. It's extremely important to, remind them of that. And encourage them, tell them to dispose of old dressing in a plastic bag before placing it into the garbage, because if there is any microbes in there, it can just contaminate everything else. Cleanse the wound before applying a new dressing. The wound can be cleansed by water, saline, or wound cleanser. However the doctor orders it, tell them to follow the doctor's orders. And also, it's important to tell them to contact the healthcare provider immediately if the patient has fever, chills, increased amount of pain, swelling, or redness at the wound site, separation of the wound edges, or changed in wound drainage, color, odor, or amount. Any changes like that, to notify the healthcare provider immediately. Managing psychological effects of wounds. Remember, we said wounds have a psychological effect on people. Nobody likes to have a, stage 4 pressure ulcer on their sacral area, right? Or like, bed bugs, or, any other disease, any skin condition. So we want to, promote this, patient's psychological status as well. So we manage their pain, whether pharmacologically and non-pharmacologically. You help them with their anxiety and their fear, show empathy, encourage expression of their feelings, answer questions accurately and honestly, maintain their dignity when you're taking care of them, and assisting them with activities of daily living, because these are all impacted by the wound, and financial, medical condition, all of these are impacted by that. You have activities of daily living and instrumental activities of daily living. Provide assistance as much as you can, or and provide resources to your patients. They have changes in the body image. They look at their body, the wound on their body, and it affects them. So help them to, identify goal thinking, assess the adequacy of knowledge, and consult with, helpful resources, anything that can help them avoid making judgments. So this is your first PowerPoint for integumentary. The next one will be on pressure injuries. Please go ahead and review that next, and use your guided notes and focus on the objectives to help you study, for this module.